Sure, thank you very much, and thank you for guiding us through an important discussion. It's important because we're here today actually to take a public stance to address a human rights violation. That's what it is. I remember, maybe you have read that last week, a story came up, was in the newspapers about Dunya. Dunya is a girl from northern Iraq, and she was forced to marriage a man of 45 years of age. This morning you heard similar stories. Now, the man whom she married just after her 14th birthday already had a wife and had 9 children. The story tells that Dunya had to endure very severe physical and verbal abuse from her husband, his first wife, and also the children throughout the 9 months of marriage. Now, last week, Dunya's body was found in the outskirts of a Kurdish village of Shekan, riddled with bullets, suspected of being in love with a boy of her own age. This is why we're here in London. This is why we're in London. Now, in this audience full of politicians and academics and thinkers and bright people, as Princess Mabel described the panelists this morning, students, there's a lot of brain power. We want to make a difference, that's for sure. We want to scale up, we want to accelerate. We all heard that. But how do we do it? How can we do it in the short term, the medium term, and long term? I'm sure that the colleagues here at the panel will give their perspective from the country they work in. At least we have to work together, obviously, but also to share analysis, to share data, to exchange best practices. We have to pool our resources from the multilateral organizations like UNICEF, UNFPA, but also from, for instance, bilateral donors like the Netherlands, because I'm from the Netherlands. We have to act and think locally. That's crucial. Tony Lake said it this morning as well. So in short, it requires that we come to a sustained partnership, an effort in support of national responses, and that we appreciate both the milestones and the baby steps to set the change in motion. And after all, it's the girls we're talking about. Their interest should prevail. Now, the example of the power of national responses will be given by the colleagues. Since a couple of months, the Netherlands is co-chair of what we call the Global Partnership on Effective Development. Maybe you remember, we had Accra, Paris, Accra, Busan, and then came Mexico. And since, I think Justin Greening was the previous co-chair, the Dutch are now. This is about partnering with the private sector, as you said, with academia, etc. Because we have to do it really together. So also, during our co-chairmanship of the Global Partnership, girls and women will be in the heart of our focus. So that, to kick it off. Thank you.
Thank you very much, Rob. Ladies and gentlemen, just to point out, there is translation available. Headsets on your chairs. You can get English on channel 1 and French on channel 2. I'm going to invite our speakers to address you one by one. They've been asked to keep their comments to about 5 minutes each, and then should be plenty of time after that for questions. And I'd really like to encourage conversation. This is about dialogue after all this whole day, and particularly this session. And panelists, thank you very much for being here. I will interrupt you if you go over 5 minutes, so I'm apologizing for being rude now, but you have been warned. And if you don't get through all your comments, don't worry, there will be chances afterwards, hopefully, when some of the questions will elicit some of those points. So let me first of all invite Minister Zenebu, who's the Minister for Women, Children and Youth Affairs from Ethiopia, to address you. She has at least 10 years in national government, years before that in state government in a variety of sectors. And she will talk about national strategies and laws to tackle harmful traditional practices. Minister, thank you.
Thank you. Thank you, Mr. Chairperson. Excellencies, ladies and gentlemen, I would like to express my heartfelt gratitude to the organizer of this event for inviting Ethiopia to take part in the summit. I am glad to see many young faces here today. I would like to tell you the story of one girl. This is a Shalom from the Amhara region of Ethiopia. She underwent FGM at 3 years old to make her a better prospect for being a wife. She was married early, but with a friend's help, she escaped and marriage eventually dissolved. Her father tried to marry her again, but she's standing up for her rights. She's in a girl club that empowers girls to involve teachers and the police when they hear about threats of child marriage. That's what is powering our efforts to change social norms in Ethiopia. At this summit, we must take it our collective duty to support Shalom and girls like her around the world, because they are the ones who are creating lasting change. I am pleased to say that Ethiopia, following a sustained multi-sectorial approach to eliminate child marriage and FGM, has registered significant reduction in the prevalence of this practice, thereby enabling our country to benefit from the active involvement of our citizens. For example, the national rate of FGM decreased by half among girls aged 14 and under, from 52% in the year 2000 to 23% in 2011. And we have witnessed declines in the national prevalence of child marriage from 33.1% in 1997 to 21.4% in 2010. It reached 8% those girls under the age of 15 in 2014. I am proud of our achievement, and I would like to share with our experience with hope of inspiring other nations to take decisive, robust action. There are 3 core elements of our approach involving political will, public opinion, and partnership. First, the government of Ethiopia has the political will to end harmful practice, and the issue is placed firmly in our national agenda. This includes a national strategy and action plan on harmful traditional practice focusing on prevention, protection, and provision of activities. In Ethiopian Growth and Transformational Plan, we included empowerment of women through eradication of HTP. We revised our penal code to incorporate to practice the child marriage and other forms of HTP as a criminal offenses. Secondly, we focus on public attitudes to change social norms. The government has conducted an awareness campaign for decades on the negative impact of child marriage, following a strategy of engaging girls and women, tribal, religious, and community leaders, as well as those responsible for carrying out HTP, such as circumcisers. Community-based grassroots program like Fnota Hiwat, which means pathway to life, are demonstrating good results, and the sense of taboo around this issue is being broken down, and the general public is discussing them more openly. Finally, our work would not be as effective without relentless effort of our development partners, civic institutions, non-governmental organizations, the international community, and other actors. I must praise UNICEF and the Department for International Development for financing and providing technical support for several programs. Partnership efforts such as the National Alliance to End Child Marriage and the National FGM Network are fostering innovation, sharing best practice, and improving data collection. Political will, public opinion, and social norms, partnership, these 3 elements are core to an effective strategy to end harmful practice. While I am proud of this achievement, I also recognize that there is much more we must do to honor our commitment to eliminate child marriage and FGM. Future priorities will include targeting men and boys as influencers of attitudes and behaviors, reaching more girls and boys through schools and youth centers, and building capacity of women associations. I would like to thank our partners for their support in helping create a positive, enabling environment for Ethiopian girls. The government of Ethiopia is hopeful that this support and collaboration will continue until all forms of harmful traditional practice are abolished from my country. Thank you for your kind attention. Thank you.
Thank you. Next, I'd like to invite to speak for comments Patricia Barr. She's the National Coordinator for the Teenage Pregnancy Secretariat of the Government of Sierra Leone. And now the President of Sierra Leone launched this strategy, which is providing a roadmap to change the lives of girls and boys in that country. It highlights the specific actions that are required in all sectors, including health, education, protection, gender, justice, and many others. We talked about a multi-sectoral approach. I'm going to ask Patricia Barr now to speak about that initiative.
Mr. Chairman, ladies and gentlemen, Kadiatu is 16 years old. She's already a mother and has dropped out of school in order to care for her 4-month-old daughter, Zainab. Aisha, now 13 years, was raped when she was 11 and gave birth to her child through CS, with serious risk of her and her baby's life. Maria, too, 14 years, lost her father and was forced to marry an old man. She dropped out of school, became pregnant, and died at childbirth. The story goes on and on and on. 1 in 2 girls are married before 18 years, 1 in 5 before 15 years, and 35% of our pregnancies occur before the age of 18. 40% of our maternal deaths are due to teenage pregnancy. Girls in Sierra Leone are at risk from a very young age. They are suffering from violence, exploitation, and abuse, and as a result are deprived of their basic human rights. And for too long, we have looked the other way. Our Excellency, the President, saw it fit to launch a national strategy for the reduction of teenage pregnancy and early marriage. The main outcome of the National Poverty Reduction Strategy paper, which is the Agenda for Prosperity 2013-18, is that by 2035, Sierra Leone will achieve middle income status with socially, economically, and politically empowered women contributing towards its national development. The agenda interventions are at all levels of society to develop comprehensive programs which address the needs of vulnerable girls, including to access education, health, protection, economic, and social support. In order to achieve this national priority, the government is committed to end child marriage, harmful practices, and teenage pregnancy, and to shift cultural attitudes to protect girls' rights. In response, a multi-sectorial coalition of stakeholders were mobilized to collectively develop a national strategy which adapts a multi-sectorial and coordinated approach to tackle the drivers of teenage pregnancy and early marriage. In May 2013, His Excellency the President launched the national strategy. The oversight of the implementation of the strategy takes place through a multi-sectorial coordinating committee chaired by the Minister of Health and Sanitation and co-chaired by the Minister of Social Welfare, Gender and Children's Affairs. The multi-sectorial technical committee, which is chaired by myself, that brings together 6 ministries, all UN agencies and donor partners, and more than 45 civil society organizations. The coordination meetings are held at national and sub-national level on a monthly basis. The national strategy provides a roadmap to change the lives of girls and boys in Sierra Leone. It highlights the specific actions that are required in all sectors, including health, education, protection, gender justice, and many others. There are 5 main pillars in the strategy: improving policy and legal environments, improve access to quality SRH services, protection and education services, comprehensive age-appropriate information and education, empowerment of communities, adolescents, and young people to prevent and respond to teenage pregnancy, coordination, monitoring, and evaluation mechanism across sectors for proper management of the strategy. It provides clear strategic plan to ensure that all stakeholders focus on the same priorities and avoid duplications. This includes the recent development of a comprehensive M&E plan to monitor changes at outcome and output level, a national communication strategy and plan for behavior and social change, and mapping of all partners working in these sectors. The government is actively working with development partners, parliamentarians, communities, traditional and religious leaders, families, and young people to address this issue through a national plan and actions. For example, more than 345 boys and girls are provided with social and economic empowerment, and men and boys are trained as advocates. SRH is included in this educational curriculum, and it developed harmonized life skill curriculum for out-of-school adolescents. More than 3,000 health workers, teachers, social workers, police officers were trained. Health clinics are providing youth-friendly services and 100,000 girls we are giving educational support through outreach campaigns in all districts. We recognize that there is much work still to be done, and in this regard, we appreciate the UK government and UNICEF joint effort to host this important summit. We know that we will not be judged on the effort we make, but on the impact of girls' life. We will be judged on the changes we make in Sierra Leone society, on the changes in the lives of our girls. In conclusion, Sierra Leone, we are convinced that the choice and opportunities available to adolescent girls will contribute to break the cycle of poverty. This is what we are trying to do with this strategy. We are saying that the new generation of children in Sierra Leone can be educated, stay healthy, and one day contribute to the economy of the country. Girls like Kadi, Aisha, and Mariatu cannot afford for their rights to be continually unmet just because they are born girls. Today, tomorrow, and the day after, we must keep fighting that girls can be girls, not mothers, because we cannot afford to live in a world where they are unable to dream about their future. I thank you all.
Thank you very much, Patricia Barr. Our third speaker is going to be Raj Kumar Mahato from the Nepalese organisation BOR. It campaigns to stamp out child marriage and the dowry system. He'll speak about the campaign he's been working on, as well as the importance of mobilising young people for sustainable change. Raj Kumar.
Thank you so much, sir. Thank you so much for organizing this summit and providing this opportunity to BOR to share its experience and best practice. And I'm going to talk about the campaign, its experience, mobilizing the youths and adolescents. I'm not talking about the effect, consequences, data anymore, because we have already talked a lot. In the morning, we have lots of reports and documents. So basically, the campaign is a national campaign to eradicate child marriage and dowry system in Nepal. And from this campaign, we are not discovering, but we are proposing a new terminology, definition of new terminology, new perspective. That is togetherness. Like we talk about coordination, partnership, collaboration, and top of that, we are talking about togetherness, because it's everyone issue. It should be responsibility of everyone, and everyone should come together to end this practice. Not that some organizers or somebody will ask anyone or any organization to come in front. So we should come in a common front by own initiation, by watching or seeing others' perspective or initiation. So we term it as a multi-sectoral togetherness towards a social and economic change. And if we talk about like social economic transformation, then we are putting an agenda of child marriage and dowry eradication as a prerequisite. Without ending child marriage and dowry, we won't be able to get the transformation in economy and society that we are expecting. So this is a major crux of this campaign. And this campaign has started in 2005 from one village development committee, which is the lowest administrative unit of in Nepal. This is from the Dhanusar district. It's basically in the region of Janakpur zone. It started from a very small activity called International Program on Sexual and Reproductive Health with School Adolescent. So we had an interaction program over there, and then 9 class boys raised a question with us that you are just cutting the leaves of a tree. You are not cutting even a branch, and then you are claiming that you are going to stop all this harmful practice. We are going to improve the status of adolescents and youths, and particularly girls and women. If you are going to do this, then you have to cut the roots. That we talked about in the development people, we talked. So 9 class boys raised that question, and from that discussion, it came into mount, and he proposed that you should work on the child marriage and dowry. Otherwise, you are just picking up the leaf, and it is not going to stop all those harmful practice. And then we discussed, and from that interaction, actually, the concept of child marriage eradication committee emerged over there. And the youth and adolescent of that school actually formed a committee called Child Marriage Eradication Committee from one single VDC. And in the span of 2 years, other youth and adolescent of other BDCs replicated that committee in additional 33 BDC on the span of 2 years on their own initiation. It was not directed by any project, not directed by any donors, not directed by even the government. It was the initiation of like adolescent youth on themselves. And they mobilized the influential people. Influential people means social leaders, political leaders, religious leaders in the BDC, in the community. And they started lots of advocacy initiative and established the social norms against child marriage and dowry. And they give slogan like, child marriage ruins life, save girls, stop dowry. These were the very famous slogan against this harmful practice, and that has been chanted by the even children, elder people, women and girls. So in this way, they formed 33 child marriage eradication committee in one district, and after that they brought many organizations, about 34 organizations, government, non-government, and media and donors, and they organized a national conference on, first ever national conference on child marriage and dowry in 2007 in Janakpur, Dan of Nepal. And from that conference, actually, a child marriage and dowry eradication federation was established, of which about 100 organizations are the member of that federation. And 7-point Janakpur declaration was made against these harmful practices. And the trend of felicitating the real youth activists who rejected child marriage and who rejected the dowry, they were facilitated by like deputy chairperson of the Constitutional Assembly of Government of Nepal at that time. And after that, the campaign is moving ahead. I'm making brief considering the time. So thereafter, the campaign is moving ahead. The media coverage, even the media that coverage on the child marriage and dowry has been increased a lot, significantly increased. Even the resource investment have been increased a lot. And that child marriage eradication committee that have been involved from one BDC was further scaled in 3 districts by different donors and organizations. And right now, just in 2-3 months ago, a very famous Nepali celebrity, that is Garima Pant, who won the Shark movie award, best actress in the Shark movie award, and the Dr. C.K. Singh, both of them humbly accepted to be a goodwill ambassador of this campaign free of cost. They are not giving even charging travel cost or anything else. So they are doing a goodwill ambassador free of cost for that. And just recently we had a discourse program with the CA member. We are very fortunate that Nepal government is in a process to draft its new constitution. So we had an interaction discourse with CA member to put this child marriage and dowry is one of the agenda incorporated in the new constitution. So we have a dialogue and lobby with that. And recently Ministry of Women and Social Welfare and Children have started to develop a national strategy to end child marriage with support of UNICEF and other donors and partners. We are, from this campaign, we are providing the technical assistance to that. So this is basically like to that experience and briefly about the campaign. We can answer if is there any question.
Okay, thank you. Finally, I'd like to call upon Laura Lasky to speak. She's the Chief Reproductive and Sexual Health at the UN Population Fund, and she will speak from a global perspective about multi-sectoral responses and girl-centered programming. Laura.
Okay, thank you. Thank you very much. And I just want to highlight one important message that it will cut across the 4 things that I'm going to say about it. The focus on the adolescent girls. This is so important from our global perspective. What we have seen is what, it works. One point is a girl-centered approach requires working across sectors. But those sectoral approaches should manifest at the level of the girl. Work of governments, civil society should converge around the girl. For example, in Niger, we have been working with the girls and making sure that they can have a health checkup, that's the health sector, that she can gain friends and a mentor in girls that are in the same situation that she is, that she can participate in micro-saving groups, and that she get literacy training. So these are several sectors converging on focusing on the adolescent girls. The second point is one lesson that we have learned is that strengthening the health system and strengthening the education system is not enough. We need to make sure that those systems are, reaching the girls, that the girls are connected to those systems, because many times we focus on the education and improve the health and improve the quality of both sectors, and this is excellent. But from this sector on child marriage, we need to make sure and able to connect the girl with those sectors, and so that they benefit from it. The third point that I want to say is that the child marriage is a very complex issue, and the solutions also require complex approaches. And the question is that all the actors, the UN agencies, together need, with the civil society and the different actors, need to really align within the national policy, legal and programmatic frameworks of the governments, again, serving the girls. And the fourth one is that we talk a lot about scale and sustainability of the programs, and we have long debates about this. And what we have seen is that when there is national commitment and the consequences on the lifelong and also intergenerational investments, we see changes. The announcement of the government of India just right now, but also a program that India has announced last year on health, adolescent health strategy that will impact 250 million girls. We have a lot of hopes on that program because it will really address the issue of child marriage from that perspective. So a commitment of the government from that point of view is also so important. This is what I want to say.
Okay. Thank you very much to all our speakers. We have plenty of time for questions, which is great. So I'm going to invite any of you who have points to make, questions to ask to our panelists to raise your hand. I'll call on you. Anybody like to start off with the questions? Okay, well, while you're thinking, as I'm sure there will be questions, I hope there will be questions, let me start off by maybe getting the ball rolling. And let me start by asking this question to you. Minister Zenebu, you were talking about you gave us a really good example of a girl who was standing up against harmful practices, and that you talked about girls are the ones who are creating lasting change. But I want to know, how are girls in your country participating in the development of national plans? Are they, or is that something that you think could be done better? And how are they involved in monitoring government's commitments? Please do.
Okay. Thank you. Actually, the government is committed for formulation of policies, programs, and packages, and even the law. But laws, policies, and programs by itself is not an end. We need to have to implement it. Just I would like to share two best practices. One is the government is trying to expand schools education, and we have formal education as well as informal education. And we have also 14,000 health extension workers are deployed at grassroots level. The third one is we are trying to organize women as a group. Women as a group, one group it's nearly around 30 members. We have 30 members, which is led by model women. So they are networked 1 to 5. Especially, I think you know that Ethiopia has achieved the Millennium Development Goal of child mortality. So we are trying to decline the child mortality as well as maternal mortality, including harmful traditional practice. I mentioned earlier, what I did is that we are trying to organize women as a group, and it's networked 1 to 5. They discussed about their harmful traditional practice. Even if there are pregnant women, they go there, they try to identify who are the pregnant women, and they are trying to give counseling. And not only giving counseling, they also link it with health centers. So if anything is happened within that network, the so-called FGM as well as child marriage, they go to the court and they apply it to the local administration. Not only that, even the family, if you want to, whether the girl or the boy, if he's under the age of 18, they try to tell the local administration. So the local administration, he doesn't have any mechanism to identify whether he's age of 18 or she's age of 18. So they send with a letter to our structure. We have our structure, Ministry of Women, Children and Youth Affairs, up to district level. So the district, they link with the hospital. So if he's eligible for marriage, he can marry. If not, they will be banned. The other one is also, there are a lot of schools. Within that schools, there are girls' club. So within this girls' club, if there is something is happened, the girls' club has great role for tackling of child marriage, as well as women's teachers are also highly involvement and highly, I would like to appreciate them on behalf of our government. They have a lot of experience regarding to ban child marriage. This is what we do. The other thing is they also involved in the monitoring and evaluation, especially at community level. So they have their own voice, especially at women's association. There are a lot of women's association at grassroots level, and there are also different projects like what I have mentioned about earlier, Berhane Hewan projects. That's community program. So within that community program, the so-called those women are involved in their voices, so that they know what they did.
So when Laura Lasky is talking about the importance of making sure that girls can connect to the
Yes.
policies you put in place, this is
Yes.
exactly an example of that.
Yes.
And would you say the elements you've highlighted are key to the successes you've seen in reducing the rates of
Yes.
early marriage?
Yes.
Okay, great,
May
thank
I,
you.
May I mention?
Briefly, yes.
Yeah. Just earlier, regarding in the year 2000, the FGM was nearly around 52%, especially the northern part of Ethiopia. It reaches nearly 80%. But by now, at national level, it reaches 23%. Even the child marriage, when we said in 1997, it was 33.1. In the year 2001, in the year 2010, it was 21.4. And now it declines to 8%, the so-called those under age of 15. So you can see even we have a remarkable achievements, but still we need to work more and more. We need to become to zero. And also we have already put it in the growth transformational plan in the year that was 2010 to 2015. Hopefully we will achieve our plan.
Okay, thank you very much, Minister. I think we had a question over there from that lady. Hi there.
My name is Nana Otuyote. I work with Forward. I would like to ask the two speakers from Ethiopia and Sierra Leone, particularly about the government policies around pregnant girls returning to school. I do know that that is a major issue in Africa, and girls who are pregnant are often removed from school and don't have access. And re-entry is a big challenge, and particularly tackling child marriage and teenage pregnancy really require attention to these issues. In some countries, so many girls are turned out as a result of this. So I would like to know a little bit about how you're doing it and enabling child brides to be able to go to school, because a lot of them have said they want to go back to school. Thank you.
Thank you for that question. Patricia Barr, I'm going to put that to you. Obviously, you're here to talk about the national strategy to reduce teenage pregnancy, but what about girls who are already pregnant and returning to school, as the question was raised?
Thank you. We have the Child Rights Act 2007, and within the strategy we have created, within the strategy there are policies that have been put in place to make sure that when these girls get pregnant, there is no law banning them from going back to school. After giving birth to their babies, they have the right to go back to school. But if they don't want to go back to school, they can go into institutions that have been created for them. For the pregnant girls to go to school while they are pregnant, we are still debating on it, because there is a school of thought that is saying that if they allow them to sit in class with the girls who are not pregnant, they are sort of like going to encourage them to look at it like as if it's normal for somebody to get pregnant and continue to go to school in the same class, and will have more increase in pregnancies than reducing it. So the Ministry of Education is working on how we can have like a special institution for pregnant girls where they can go and take their exams, and when they give back, they come back into the normal system if they want to. That is what we are doing presently as a government. It's within the strategy for them to go back to school. There is no policy or no law that is banning them from going back to school after giving back.
Minister, would you like to comment?
Yeah. Regarding to education, actually, we have different policies. We have education and training policy. So within that education and training policy, every child should have to go to school. So the mother should have to send her children. What I have mentioned earlier, I said Women's Developmental Group. We call it Women's Developmental Army, because army is protecting from our nation from enemy. Our enemy is poverty. Not only if the woman is poverty, is on the line of poverty, she doesn't have access for education, she doesn't have access for finance, she doesn't have access for health. So this women developmental group it's an integrated approach. So we use for health, we use for education, we use for economic development. So those, they know it each other. So whose mother is sending they control, they know it. Basically is focusing on, they should have to be sent children to go to school. Even if the mother by itself also, they are following informal education. So we can follow, we can monitor, so she can continue her education.
But let me just, I'm going to ask you to come back on that point if you'd like to respond to it, but let me just raise a point here. The issue, though, is you may have laws which say that all mothers must send their daughters to school,
yeah.
But if they're pregnant, are they able to go to school? And what is the stigma of them going to school? Are they prevented from actually carrying out that law?
Yes, that's what I'm saying. The pregnant woman they went to school. If at the time of delivery, she will discontinue her education. Then after delivery, she will continue her education.
Ma'am, would you like to come back on any of those points?
In terms of speaking to a lot of the girls in Ethiopia with partners, the challenge is the policy and the reality. Because for a lot of girls, they would tell you that if they don't have anybody to look after their children, they can't go back to school.
Yeah.
If there aren't correct facilities to enable girls to keep for them.
Okay, let's pick up another point from this lady here.
My name is Nyara Zai. I'm the African Union Goodwill Ambassador for the campaign to end child marriage. Listening to the statistics and to the presentation, we hear the names of the girls. We can see them, we can feel them. But the men are so mysterious. You only hear of their ages. In terms of the national response, so for instance, we always say 39,000 girls are married each day. I mean, that is a statistic that UNFPA the UN has with us. But who are the mysterious 13,000 men? Is there any approach at the national level which is addressing the issues of the perpetrators? Who are the men marrying our girls? And what are the strategies to change the attitudes so that they don't marry our girls? Because yes, the girls can be in school and everything, but we also need to deal with the other side of the equation, knowing that it's violence against girls, it's a criminal act, it's sexual abuse and all other factors. So that's my first question. The national response, is there any strategy to address the perpetrators? Who could be the fathers, the grandmothers, the adults who are supposed to be responsible to the girls? My second question relates the national action plans that you have in different countries. What are some of the barriers and challenges that you have faced in implementing a comprehensive national action plan to address the issue of FGM and child marriage? And my last comment is the global links with the local. We are very excited about having a commitment to ending child marriage within the post-2015 agenda. And yet when I look at Goal 17, which is about the means of implementation, that is what connects to the resources in the country or the partnerships, I don't feel sufficiently a conversation on that. So I would like to hear from the Minister from the Netherlands on what are some of the discussions around strategic partnership and development effectiveness in terms of linking the approaches to resourcing interventions. Thank you very much.
I'm assuming your first two questions were directed to our guests from Sierra Leone and Ethiopia again. And ladies, both of you have talked about the importance of targeting men and boys and making men and boys advocates. The question, though, was about national strategies on perpetrators. not necessarily bringing them into the conversation, but identifying who they are and stopping them doing this. So who'd like to, one of you would like to talk about that?
I'll start and then the Honourable Minister will take from me.
Please do.
For us in Sierra Leone, within the strategy, we are, Pillar 1 is talking about creating an enabling environment and making sure that we have a legal framework. We have laws that have been created, and within those laws, the perpetrators, like for example, sexual penetration, you have to go like 14 years imprisonment. And what we are doing now, we are trying to create what we call community bylaws. And we are working with the Ministry of Local Government to also create what we call uniform bylaws that will be implemented at community levels for these perpetrators so that they can bring them to book. We have men groups like Fine Saloon that is supported by UNFPA. These are men advocates. We have men and boys who are advocates against teenage pregnancy, early marriage, and for Sierra Leone practice FGC. And they are fully involved at national level, and they are part of the strategy, and at district level, making sure that they work with the local communities. If I can just take from the speakers this morning, we have to make sure we implement something that we can, we implement interventions that one, the community will not frown at. That is why for us, for the FGM or the FGC, we have tried to make sure that we are working on developing the action plan. And we have like the age of consent, because Sierra Leone, from statistics, you can see that I am a victim of that. I'm a victim. And my daughter, I went for a conference like this, and my sister-in-law just grabbed her, and she was equally, she had her caught. So it's like 98, 90, in the past it was like 94%. Now our men, our boys are even advocates against that. That you can't do that to our sisters, you can't continue to do that to our mothers. So we are getting them involved, and we have those laws in place, and we have civil societies. And most of these civil society, we have men who are championing issues against some of these practices.
Minister, if I may, I'm just keeping an eye on the time, and I'm seeing a lot of hands are going up. So if I might just move on from that point, let's get some more points in, if you don't mind. There were several points there. The lady in green, I think, was next. Just wait for the microphone to come to you. I just want to get more different voices in the conversation.
Bonjour. Can I speak? Hello?
Just switch the power on.
Je voudrais... First of all, would it be possible to hear a bit more on your girl-focused approach, which would implicate several sectors, because there isn't a single ministry responsible for the girls. It is a group which is made up of the Youth Ministry, Justice Ministry, Education Ministry, Social Ministry, Women's Promotion Ministry. So this is a question which is managed by several ministries, but there isn't one commitment which is taken at the level of the public policies. And there's also a problem of timing. For instance, the health ministry will have actions at a time which is not really connected to the actions taken by the other ministries. So, in your experience, how do they coordinate their actions in order to reach the objectives? And in countries where there are many girls who are victims, we have the problem of who will look after them when several girls will decide that they will denounce the fact that they will get married. You know of countries where structures have been set up in order to look after them, to care for them, to protect them, to house them, to send them to school, to help them avoid being pregnant, and then give them a job, so that the parents can welcome them again.
Victims and help them engage legal action before the celebration of the marriage. There are so many. How to identify them and help them to engage legal actions? Thank you.
Thank you very much. So first question there, I believe, was, a lot of countries don't have a single ministry for girls. A lot of how do different ministries coordinate their actions? I guess, once again, it's a question for one of you, Patricia Barr or Minister Zenabu. Would you like to comment on that, Minister?
I would like to give you a highlight. We have a national strategy regarding to harmful traditional practice. So mainly we are focusing on prevention, rehabilitation, and prevention, protection, and rehabilitation program. So within this, we cannot work by only ourselves. We have partnership. We have JOS and NGOs forum. So basically, the women's issue, the children's issue cannot be performed by only one minister. It should have to be mainstreamed by other ministers. For example, education has taken his own part. Health, he can take his own part. Agriculture, he can take his own part. So we have joint action plan. We have joint monitoring and evaluation system. We meet on quarter basis and we evaluate. We share our experience regarding to this.
Do you find that every ministry is as engaged,
yes,
as committed to this as the others?
Yes, because in each ministry there is gender directorate. So the main gender directorate is mainly focusing on to protect the rights of women, to protect the rights of children. So in each ministry have their own gender directorate up to grassroots level, besides to Ministry of Women, Children and Youth Affairs.
And on the second question of whether there should be structures so that when girls who are married early or are pregnant in teenage years are denounced, what happens to them? Laura Lasky, is that something that you could comment on? Should there be structures? Are there structures? Is there a way of creating those?
I think that there are programs, particularly there is one in Addis Ababa, in the Mercato, in one of the areas where there is the bus station where girls escaping child marriage, usually end up. And there is a program there that receive them and, try to help them in putting them in shelters and give them, access to school and also to livelihoods.
Just I would like to add, we have one-stop shop program. So in that one-stop shop program, there is a counseling, there is hospital, there is also investigation, there is also court. So she can get, if there is something is happened, she can get counseling, and the police will investigate and will go to the court. So it's structural, and they can get easily their own.
Okay, we're only going to have time for one more question. That lady in the corner there had her hand up from the beginning, so let's give her the last chance.
Hi, I'm Siva from the Asia Pacific Resource and Research Center for Women based in Malaysia. I wanted to ask two very specific pertinent points. Although the Girls' Summit is happening in 2014, it is actually reaffirming and reiterating the commitments made by all our governments as the ICPD Cairo Program of Action, as well as the Beijing Platform for Action and the ratification of CEDAW across all our countries. And we know how important these international standards and norms have been in order to put pressure on governments, that all the drops and the progress that we have achieved thus far is due to this. However, what we are seeing at the international level right now in negotiations around either the open working groups and the SDGs has been that many governments from the global south are running away from committing to human rights standards. And so that's one of the questions. So how can we actually, as the governments from capital who know that all of this is important, how can we bolster support for these issues at the international level so we can agree for international commitment towards it?
And I think, seeing as you're talking about the ICPD, we've got to turn that over to you, Laura, really, haven't we? Right. Governments are running away from their commitments to human rights-based development in terms of early marriage and FGM.
I would not agree with that point. I think that we just had a 30-hour negotiation last week in the Open Working Group at the UN, and there was one commitment that needs to be, polished a little bit, that is on diminish or eliminate harmful traditional practices, including child marriage, early and child marriage, and also of FGM. The countries, there are interesting balances in the countries, but all of us need to be committed to to make sure that the governments are accountable for the commitments they have made in the past, and they should continue to invest on those commitments. So that's really
Okay, just to wrap up then, some of the themes that I've been hearing, I think, that have come out of this session are the importance of including men and boys in your programming. Also looking at the economic perspective. Rajkumar, you talked about togetherness. So that's both men and boys, but also viewing the importance of stamping out FGM and early marriage from an economic perspective as a sort of obstacle to development. And then also about making sure that girls can connect to services and policies that you put in place. 30 seconds, Rob Schwartz-Bull, would you like to wrap up? Just give us your takeaway from this session. What do you think are the kind of key things people should be thinking about?
Well, it's a great session. I thought the question on men, I'm a man, is very important. I think we should also look at role models. That was mentioned already. I think the church, the progressive imam, can do a lot of good things trying to talk to the men instead of trying to talk to the women. And coffee houses. So we have actually programs to get to the men and not only to the women. It's a very good point.
Okay. Thank you very much to all our panellists for this very interesting session. And thank you all for your questions and for listening. Thank you. Enjoy the rest of the day.